Hello, everyone. I'm Traci Arieli, end-of-life doula and founder of Comforting Closure. Today, we're joined by Marian Rouse, a patient advocate and founder of Triad Health Advocates. In our conversation today, we'll talk about patient advocacy and explore how Marian helps patients take control of their care journey. Whether it's understanding medical jargon or coordinating care, Marian's role creates a healthcare experience that is truly patient-centered. Welcome to the podcast, Marian. It is an honor to have you here. Thank you.
Oh, thank you very much. I'm just delighted to be invited. Thank you, Traci.
Can you start off and share with us what inspired you to become a patient advocate?
Oh, wow. I think there are two significant events in my life that really inspired me to be what is now considered a patient advocacy. And the first one was in third grade. I was a brownie. The brownie troop was asked to sing at a local rest home. And I was delighted because, I could sing. I really enjoyed older people, and I thought this is terrific. So went to the rest home, walked into the social room, and I was aghast. And the reason why is all of the residents were there. They were typically in wheelchairs. But the shocking part was that they were lifeless, they were joyless. And it was a shock to me because the senior members of our family were the nucleus, and they were always a part of the family. We'd have meals together. They would tell us stories. They were well cared for, and they were really happy. So you can imagine how I felt when I saw this group of individuals who really did not have what appeared to be a really good life. So I went home, and that day I decided that when I grew up, I had to do something in my life to help the older generation have a life that is fuller, or to be as full as they possibly could. So that was a really significant event that inspired my desire to care for the older generation. The second inspirational event was much happier. It was in the early 2000s when I had the wonderful opportunity to help my parents transition from a fiercely independent lifestyle to a gradually more dependent lifestyle. And my role was of that transition was to manage their medical care. And while I never had medical training, it was a natural fit and a natural role to fulfill. And I think it was probably because I used my own experiences. I was able to communicate well with doctors, ask the right questions, and get stuff done, which is what you need to do in the healthcare system. So one day, my dad and I were at the end of a series of doctor's appointments he had, and we were sitting in the waiting room. And he turned to me and he said, "Mayor, I don't know how Mom and I would be able to get through a day like this without you." He says, he asked, "What do other people do when they don't have someone like you?" And that question spurred many conversations over several years. And we talked about, what would it take to have a business to take care of those who can't figure it out, or don't have anyone to figure out the healthcare system. So I was just thrilled that in 2020, I had the opportunity to start Triad Health Advocates and just address that wonderful question that my father posed, which was, how can we take care of those who don't have someone navigate the medical system? So I am just, believe that those two events allowed me the desire and being able to start Triad Health Advocates.
Thank you for sharing that. That's a great story. I loved it. I loved the brownie story also.
Yeah. Very memorable day, believe me. Ay, ay, ay.
So, what does the role of a patient advocate entail, and what ways do you feel that you make the most impact in your client's healthcare experience?
I think to understand the role of a patient advocate first. So, a patient advocate is a professional who provides patients support and education they need to navigate the healthcare system so that they can make their own healthcare decisions. So, a type of support that, or the types of supports that they could um, provide include coordinating the care of several providers for a single patient, sitting at a patient's bedside to keep them safe in the hospital. Another activity or role might be to help patients interpret difficult medical terminology and information. And then, from perhaps a non clinical perspective, uh, patient advocates support patients by reviewing their medical bills to find errors and duplications. So each of those type of support activities are really what a patient advocate does. Now, what a patient advocate does not do, and which is really important, is that they do not make decisions for people. They do not make any kind of healthcare decisions for patients. Our impact or key to being a good patient advocate is to empower the patient to make their own decisions about their own health care. And it provides them a feeling of control over what's happening to them. So that in general is the role of a patient advocate. Now, the way that I have the biggest impact on their healthcare experiencing, knowing what that role is, I think it's important to understand the different types of patient advocates. And two of the more common types are organizational, or what I call commercial patient advocates. And then there are independent patient advocates, of which I am one. And organizational or commercial advocates are found in hospitals, insurance companies, long term care facilities. And they do support patients in making their own, helping the patients make their own healthcare decisions. To the extent the support falls within the company's rules and policies. So, a commercial advocate within the hospital, for example, a medical navigator or a social worker or a case manager, they do help their patients help make their medical decisions or healthcare decisions, but they are bound within the company's policies. And so, therefore, they are limited on how they can help them. An independent patient advocate also provides the patient support in making their own health decisions, but they are exclusively loyal to the client. That is to say, they don't need to operate within the boundaries of any organization. They are beholden only to their client. So they don't have the inherent conflict of interest that arises when they're when the profit sectors of the health care system reside. So, given those differences, I believe the biggest impact I have on my client's healthcare experience as an independent patient advocate is that the exclusive loyalty results in more options and many times better options for the client to consider when making decisions about their own healthcare. And so I can look outside the very organization that may be creating my clients' issues. Whereas the commercial advocates need to work within that operating framework. So that's the biggest, I think, impact I have on the patient's ability to navigate the system, the healthcare system. I think the second biggest impact on my clients' healthcare experience is that I approach each engagement as a team effort. Most times people call or engage a patient advocate when they are in the middle of a healthcare crisis. Typically, they don't know how to proceed, they feel overwhelmed, and they feel alone in making decisions. So, by working as a team, I provide the patient a sense of relief and comfort in knowing that they're not alone in making these decisions, that they don't have to struggle through navigating the system by themselves. And it allows them to focus on the planned outcome rather than struggling with the feelings of helplessness that don't allow them to move forward. So, to summarize, I would say then I help them by providing them more options and then therefore the more ability to make decisions. And the second one is I give them the sense of comfort and relief that they're not alone in making those decisions.
Speaking of the healthcare systems, given the complexities of our healthcare systems, how do you assist the clients in navigating those challenges effectively?
There are a few ways that I believe I do that. The first way is I believe in keeping it simple, so that the client and I can focus on the end game. Really break down complex issues into understandable and digestible parts. That's really important because as you keep asking the question why or what, we're able to get down to really what that issue is. And sometimes the issue changes from what the issue the client thought was. So keeping it simple is really important. The other way I assist clients navigating is by building relationships with the healthcare teams. It's critical that I build trust with each of them so that we can all work in efficient and trusting way. And I do that by explaining my role, demonstrating how not only can I help the patient in this healthcare team, but I also help the healthcare team themselves. I listen to what is it that the healthcare team is struggling with themselves so that we all communicate as best as we can. I ask them, how do they like to communicate? So we use their time efficiently. I think the third thing that I have is going through all of these issues. We might run into situations or issues for which I don't have the appropriate expertise. So the third element is that I have a large local and national network of independent patient advocates who can fill in where I don't have the appropriate expertise for my clients. And then lastly, I think it's as important throughout all the above three, and that is to keep a sense of humor. I think it's so important to keep it because it breaks the tension, which clears the mind. And of course, there's varying degrees of humor. but where we can, we interject as much humor as possible.
So when you are considering uh, taking on a new client, how do you evaluate that to
Mm.
make sure you have a good fit?
You hit the nail on the head, and that's fit. So the first thing that I always do is ask myself if I am the best advocate for this client. Um, if I am, great. We can move on to the next step. If not, it's really important that I connect that individual with other patient advocates that can best serve them. Um, the second thing is that once I've figured out that I am the best candidate or advocate for the client, I have to ask myself if I have the right amount of time to properly serve the client, because the client remains at the center of my universe. And I've got to be able to um, engage them and serve them at their need, the time that they need. And I'll get into that when um, we talk about how you select a patient advocate. It's so important that I have the time to support them. The third thing that I ask when considering a client is, has the client ever worked with an advocate? And if so, what has been their experience? And what that allows me to learn is, do they have the expectations that I can meet? Are their goals reasonable? If it didn't work out, why? Is I can learn communication skills, how they work best with others. And on the client goals side, it's an I find out many times that people would like me to change the medical system, and as much as I would love to be able to do that, I can't, obviously. And so I want to make sure that the client's expectations are met. So asking him these questions about whether or not they've worked with them and what their expectations are really important when considering a new client.
I love how you mentioned the timing because many people, they understand, hey, are we a good fit? Can you do for me what I need? But many don't realize that in the kind of work that we're in, you're not taking on
Yes,
five, six clients at a time.
that's right.
You're really, depending on what the client needs. It is a very uh, time consuming part of the work. And I know for myself, if I'm sitting vigil, I could do that for one person at a time, one family at a time. So,
Yes,
it is, and they also, most people don't realize that this isn't something that we can do, uh, you know, 40, 50, 60 hours a week, that there needs to be some self-care time. But
absolute.
that,
Oh, you're so right. You're so right. Because people who are successful in your profession and in my profession are naturally empathic, and that is an exercise. It's just like running 4 miles. It takes a lot out, and you're so right. Self care is really important, and I do limit my clients to single clients at a time, because I want to be available for both of us. So that's a fantastic point, Traci.
what are some of the key strategies you use to protect your client's interest, especially during hospital stays or in planning post-hospital care?
Wow, protecting clients' interests is critical, and I would say there are imperatives as opposed to strategy. I've got three imperatives that I follow for all clients. And the first one is safety. I think about safety all the time. Is the healthcare the client getting safe while in the hospital? For a client to be safe, do they have someone staying there with them at all times? Mistakes happen in hospitals, accidents happen, and not only is that part of the safety, it's also having a second set of ears when the medical team comes in to check on the client. So that's important, having somebody at the bedside at all times when in the hospital. Also, I make sure that every client that goes into the hospital has a list of their medications, and that someone reviews that list. The person at the bedside reviews that list of medications each time a medication is administered, to ensure that it's the right drug, the right dose, given it through the right route at the right time for the right patient. And you would think that, that it sounds crazy, but the number of mistakes that are made because people in hospitals, the healthcare team are so busy, and mistakes do happen. So a list of medications to keep the patient safe is really important. If the patient is returning home from a hospital stay, I make sure that the environment is safe. Do they have the appropriate type of care? Is the appropriate equipment available? Is their house set up in such a way that it will reduce the number of falls or has the right amount of lighting? Help organizing the safest environment is what I take very seriously and is an imperative. I think a second imperative to protect the patient's interest is confidentiality. It's absolutely imperative that all information about my client is kept confidential, and this includes not disclosing information to relatives of the client if the client has chosen not to disclose that information. Sometimes the children of clients will pay on behalf of the client. I still will not disclose any information to that child if the client has asked me not to. And I do get to typically the bottom. I have a conversation with my client as to why, so that I can understand the dynamics. But if they say no and they have no cognitive issues, I keep their information confidential. And then the third imperative, and I know this is a subject that is near and dear to your heart, that is legal protection. And during every initial consultation I have with a client, I always ask if they have two legal documents that are current. And those documents are an advance directive and a durable power of attorney. And as you have, I love your experiences with this one. I'd love to learn more about them. It's amazing the number of people who don't have these documents created or updated. And so many people believe these documents are only for old people, or when they develop an estate plan, or a trust, and that they have plenty of time to create them. But guess what? We don't. So I'd love to hear your experience with getting people to create these documents. How do you get people to create them?
Yeah, it is a very interesting thing to do. It is an event. it's not what people don't realize. It's more than just filling out the paperwork.
Yeah.
It is knowing your values because it's really simple.
Uh-huh.
As an example, the advanced directive is there's 3 sections to it. You could fill out this form in 5 minutes,
Yes.
but it
Yes.
is really understanding what each of the sections is. Understanding, as an example, CPR. Well, that's I want CPR. Of course I want CPR. Who doesn't want to be,
Right.
yeah, but people don't realize that most likely your ribs are going to be broken. You'll have to be put on many people will have to be put on a ventilator. What is really the likelihood of you surviving depending on your health and your age. I have people who say, yeah, I want CPR, but I don't want to be put on a ventilator. I don't want help breathing. So these
Right.
are discussions that you need to have. You need to understand the choices, but also you need to have those discussions with your family members, the person that is your
Yes.
healthcare advocate. You need to your all of your children. If you have more than one child, you really
Hmm.
need to sit down and have a conversation. So what I do is I always start out, as I said, you could fill out this form in 5 minutes. It takes a good 3 to 5 hours when you're
Hmm.
working with me to go through the what everything means and to have those conversations, so that people understand what your intent is, what is important to you. Because that piece of paper, the only thing that's valid on that piece of paper or legally binding is the person that is your healthcare representative. You can't put all of the different scenarios in that piece of paper. And so that's
Hmm.
why you need people who understand, including your advocate. And you need to have that piece of paper really front and center because, as you've noted, people in the hospital, the doctors, the nurses are really busy. They're not going to
Yes.
come in and read a piece of paper.
20 page.
Yeah,
Yeah.
I've had
Right.
clients that have actually had uh, a copy of the advanced directive as an example on their headboard on the um, door, and they're
Yes.
still not followed. Um,
Yes.
so having an advocate is very important. So yeah, I'm very passionate about that, as you know, and also setting up the trust, setting up those things, and having the conversation after you get done with your attorney, having people come in and speaking with the
Absolutely.
attorney also, because I think that the greatest gift, or one of the greatest gifts that you can do for your family, is to
Yes.
have this so there's no doubt about what your wishes are, and so that they can really focus on taking care of themselves and being there for each other versus trying to figure this out.
Exactly. And instances where members within the family have totally different ideas of how that family member should be cared for. Those kinds of discussions or arguments or whatever you want to call them need to take place before that decision needs to be made in the hospital setting or wherever the setting is, and not while they're trying to figure out how we're going to care for you. I mean, that's so important. Have those conversations before, have those disagreements before, so that you can come at the right time together as a single unit. One of the things that I really believe needs to happen is to get everyone over the age of 18 to create these documents. And I've talked to CEOs of companies about making this a part of their benefits program and talking to younger people about doing this. And I'm curious, how do you go about talking to younger people that these are not old folks documents? You could be hit in the middle of a crosswalk downtown San Francisco and not able to talk about it, speak for yourself at Mission Emergency. How do you talk to younger people and get them to see how important it is to have these documents?
So there are different ways. Part of it, when I'm working with older people, when I say older people, sorry, I'm not really meaning older people, people older than 18,
But
but
18, yeah.
people who have children and who
Mm,
are in high school or
mm,
looking at college. I tell the parents, you really need to have these papers done, the advanced directive done, because God forbid something happens to them because of
right,
HIPAA laws, it'll be more difficult for you to get information from the doctors. And
right.
family members, parents don't realize. They think, yeah, my kid's going to college, I'm still fine. I'll be
Yep,
able to get that information. It'll be easy. It isn't. So, and
it
that's
isn't.
not something you want to have to deal with at that time. Um,
Yes.
Also, there's a lot of community outreach. So, I'm starting to, there are death cafes. There are, I'm going to be starting to do some community outreach to even libraries. So there are different
Oh, great.
places that you can do that. It is not an easy conversation because
It isn't.
young people don't think about this. And it's
Yeah.
such, when you're in the moment, it can be so heated. You mentioned before that family members arguing, and you should get these
Hmm.
arguments out beforehand. I was
Hmm.
fortunate enough that my parents were able to talk about, their trust, their will, but for the things that
Yeah.
they have, their house, the things that they have,
Right.
nothing about the healthcare, what they wanted healthcare wise. And when my brothers and I
Interesting.
started to talk about it with them, there were disagreements that happened. And I told my parents, and my parents were like, oh, we'll deal with it later. I said, no, because these things, it's great that you've said on your will what you want and,
Hmm.
who you want to have, the jewelry, who you want that to go to. But that's not what's going to break us up. What's going to
Right.
break us up is, hey, mom, you're sitting on a ventilator. I think you shouldn't be on it. And I'm thinking you're going to be in pain.
Hmm.
That, and my older brother or someone doesn't agree with that, that
Yeah.
is what's going to break us apart as a family.
And it's heartbreaking.
Yes.
It's and unfortunately, it's everlasting
Yep.
in many cases.
Yep. Eh,
Well, I'm excited for your community outreach. This is great. This is wonderful.
but going back to the advocacy, and I know that you need to get that information also, and you need to know that information, and you could be a wonderful resource to help calm that when the family's in the heat of that.
Yes.
So I'm sure that's a
Yes.
really significant challenge that you go through. But what are some of the other challenges that you face as a patient advocate, and how do you move through those? How do you overcome them?
I have to say the single biggest challenge that I have today is to get clients into their provider of choice or doctor of choice as quickly as possible. Today, so many specialists probably have months long wait lists for appointments. And sometimes I can help get earlier appointments by using my network, but many times I can't, and the client has to wait. And it's so frustrating for everyone. It's obviously frustrating for the patient. Time, is ticking. It's frustrating for me because I can't help deliver what they need, and it's really frustrating for the healthcare provider. They want to serve as many patients as they can, and given the demand, particularly in the geriatric area, which is my specialty, it's just there's as one geriatric neurologist explained this week. I was talking with him. He said, you know there's a labor shortage, and it's crazy to think, there's a labor shortage in the medical world, but there is. And so that truly is the biggest challenge for me. Most other things compared to that can get through. This one is really difficult, really difficult.
So, what are some of the benefits of having an independent patient advocate?
Well, I think I spoke about a couple of them. One is that because um, we work as a team, patients don't have to feel as though they're working by themselves. They don't have to struggle along. Um, by making sure that the client remains my focal point, there's more freedom for advocates to select different types of options for their care. There is one other one that I haven't talked about that I think is really important, and we've found that having an independent patient advocate improves the patient's health outcomes. And that's really important. And we found this through the results from a survey of healthcare providers. And they were the providers who had patients that had independent patient advocates on their healthcare team. Of those providers that were surveyed, 98% of them agreed that the advocate's involvement positively impacted their patient's care outcome, their patient's outcome from a care perspective. And what a wonderful testimony to the benefits of having a patient advocate, so that it just validates what, as a profession, we believe have happened. So now we have data behind that.
Nice. Very nice. Congratulations. That's great to hear. Um, how do you see your role or the role of the independent patient advocate evolving?
I think, given that the healthcare system isn't going to change or improve significantly anytime soon, the profession will continue to grow rapidly. There's just no doubt about it. I also believe that the profession is going to evolve from being a well kept secret to becoming the norm, that every patient's healthcare team will include an independent patient advocate. And I base that belief on two things. One is the results from the um, the survey that I just mentioned about it improving the patient's health outcome, and therefore more providers spreading the word about the benefits of having an independent patient advocate. But I think that with the increasing demand by the healthcare system to become more efficient, um, or I think you could also say wanting the healthcare profession to see more patients in the same amount of time to bring more to the bottom line, so being more efficient, um, the services of a patient advocate will be in greater demand because of the benefits we bring to this healthcare team. So I think the awareness growing, and the need to really make the healthcare system more efficient will evolve the um, the healthcare team to include independent patient advocates.
Now, today, independent patient advocates, they're not covered by insurance, are they? And
No, typically they are not.
yeah, and do you see, because that's the same with end of life doulas, we're not covered under insurance. Do you see that changing anytime soon?
Well, I don't know if I see it. I hope I don't. And the reason being, And it's all about being beholden to the client only. And once you've got somebody that's telling you what you can and cannot have, or what we will pay and will not pay, I'm I just don't think it's a good thing. So let's just say I'm not pushing for it.
Same with it's interesting because we have those same kind of conversations in
Yes,
our network, and seeing what birth doulas who are now starting to be covered, what kind of regulations, what kind of things they can and cannot provide, how much they can be paid, and it's not even a livable wage if they go through it.
wow,
Well,
yeah,
I won't say it's not a livable wage. I'll just say that it's really um, it's really unfortunate. But
yes,
it is, as a patient advocate, as anyone in this field can tell you, we want to be able to do what's right for our clients.
right.
And you've hit the nail on the head. Due to financial reasons, so that these companies
Mhm.
could benefit more, a lot of times harms the client.
Absolutely. I- And how do you put a value on saving life? It's just let's just keep them away for a while.
Yeah, I agree. Um, when choosing a patient advocate, what should a person look for?
I'm glad we are touching on this. Great. Um, Way back in your introduction, you talked about fit, and so what I would suggest to everyone, the way I would start is find an independent patient advocate that fits your need, that has the expertise that you need. And you can do this by searching local and national independent patient advocate directories. In the Bay Area, there is an organization called BACA. It's the Bay Area of Healthcare um, Advocates, and that organization has a really very good directory of independent patient advocates. Um, Outside of the Bay Area, there are several strong national organizations that have similar directories, and both kinds of directory, local and national, have three basic areas that people can look at. One is what the patient advocate's expertise is, the geographical area in which the advocate works, and then the background of the advocate. So, reviewing directories such as those, and Traci, I think you would you be able to put the links of maybe four or five different agency uh, directories into your broadcast overview or background? Okay, beautiful. Thank you. So, so when you look at those directories, you'll be able to figure out just exactly the kind of person that you think you need. Once you find a group of people an advocates that you think are good, then speak with them, connect with them, and really connect with them. It's really important. This relationship it's a personal partnership that you're going to form. So it's really important that there is a connection with the person. So when you call them, you'll figure out, just like you would any other professional, is this going to work, or if is it not? If it is, great. If it's not, go on to the next step, or the next person that you've chosen. Give them a call, send them an email, and connect with them. Once you have found somebody that you feel you can connect, there's some questions that I think really need to be asked, and that is whether they've had similar cases as yours, and if so, what were the results? What were some of the pitfalls? Um, ask how long has the patient advocate been in practice if you can't see that from their website or from the listing. Find out what their availability is. And Traci, this goes back to our discussion about the number of hours that we devote to clients. It's really important to figure out, do you need a patient advocate that is available on an emergency basis? Do they do that? Are they available only by appointment? Or are they available specific days of the week or times of the week? So it's really important to find out the availability of the patient advocate that you want to engage with. And then ask how they like to communicate, and how long should they being you, the client, how long should I expect a response back from the patient advocate? It's the similar question that I ask of healthcare team members. So that's important. If you find out that they only like to communicate by telephone, then you need to get a hold of them by phone, and that likely you will get an answer once you get a hold of them. If they are going to only communicate via email, you might have to wait a little bit longer to get an answer, but make sure you know how long is longer, so that your expectations are met. And then lastly, find out how they bill. What are their payment terms? That's important. So these questions that I'm suggesting you ask a patient advocate are not unlike the questions you would ask of an attorney or of a tax accountant. Just make sure that the patient advocate that you select, you are very comfortable with them, that there is a connection, and that they're the right match for you.
For those interested in pursuing a career in independent patient advocacy, what advice would you give them?
Wow. Because the state of the healthcare system, the sky is the limit for the opportunities for patient advocates. So I say go for it. One thing definitely is, educate yourself further on what patient advocates do. Let's see, there are several series of podcasts that are sponsored by the Alliance of Professional Healthcare Advocates, of which I'll put give you the link, Traci, that you can include. And the podcasts are entitled, Is Independent Advocacy Right for Me? Those are really good to listen to. There is a great book entitled So You Want to Be a Patient Advocate, and it's by Tricia Torrey, who is a pioneer in the patient advocacy profession and is an outstanding advocate. And I suggest you read that book. So educate yourself further as much as you can. And also, not only reading and listening, I would advise you to take or to conduct informational interviews with patient advocates. Contact them by using the directories that I mentioned before, and ask them about their career. What is it like? What's a typical day like? What are the good parts? What are the bad parts? And I'll tell you, we want more patient advocates. And I know most advocates would love to make themselves available for interviews. So don't be afraid to contact people. I think, what is that? I think it's 90, people like to talk about themselves 98% of the time. Advocates are no different. They want you to become advocates. So we'd be delighted to talk to you about our career. And then you might, a person that's looking at the career might consider looking into certificate programs, patient advocacy certificate programs. UCLA has a patient advocacy certificate program. Sarah Lawrence does as well. I know the UCLA program, it's 100% online, and it provides the fundamental knowledge required to pursue a career in patient advocacy. So do a search on patient advocacy certificate programs, and you'll find at least the UCLA and the Sarah Lawrence, and there are more and more that are coming into the education world that you'll be able to use.
Thank you for that information. I'm sure you'll be getting lots of calls. You
That,
might be getting busy over the next few.
excellent.
Looking back over your career, what are some moments or cases that have been particularly meaningful or impactful for you?
Talk about keeping it simple. I don't. I honestly think the impact is felt and is meaningful when I have a conversation with a client and I hear that their voice is calmer or less stressed. That's when I know that I've made a difference for them. Um, as I mentioned earlier, clients call when they are right smack in the middle of a crisis. So it's really rewarding when I hear them say that they feel better, or when they say, I can take it from here. For me, that's when I know life is good and that I've been impactful. So that is truly what, not so much a case, but each time when I hear those voices, particularly when they say I can take it from here, I mean, boy, nirvana.
I understand. So, Marian, thank you so much for being here today. Before we leave, can you tell our listeners how they can get hold of you?
Oh, absolutely. Thank you, Traci. This has been just really wonderful for me. Thank you. Sure. You please go to my website. You can. It's Triad TRIAD Health Advocates, all one word, .com. Click on Contact Us. And in the body of that form, just indicate if you'd like a 30-minute consultation or a 60-minute consultation. The difference being that the 60-minute I'll provide an assessment and a next step plan. But just go to the website and click on Contact Us.
And we'll put that also in the description so people can have a link
Thank you.
into it. You're welcome.
Brilliant. Thank you.
So, folks, I hope today's discussion has highlighted the critical role of a patient advocate in healthcare. Remember that a skilled guide in your health journey, whether for yourself or for your loved ones, can be a game changer. Thank you for joining us. If you have any questions, please comment below or reach out to me directly. And if you found this conversation to be helpful, please like, share, comment, and subscribe. This is Traci Arieli from Comfort and Closure, wishing you peace and comfort in your journey. Until next time, take care.